to Aesthetic TV. I'm Stuart Brazell coming to you from the stage of the Aesthetic Show. And with me today is Dr. Leif Rogers, a prominent Beverly Hills plastic surgeon. Welcome, Dr. Rogers.
Thank you for having me.
And today we're here to talk about the newest trend in male aesthetics. It used to be that you wouldn't find a man in a plastic surgery practice unless he was the doctor. With very few exceptions, most patients getting procedures have been women. But in recent years, increasing numbers of men hope they can improve their appearance and give themselves an edge, both in business and in their personal lives. We're also joined by Dr. Rogers' business partner, Rand Rusher, RN, who specializes in facial injectables. Thank you for joining us.
Thank you.
Okay, so let's get to it. What is driving this trend towards male aesthetics?
It's a very interesting question. I think it's truly multifactorial. There are many different influences, and it also depends on which subgroup, because men in a whole isn't just one thing. We have older men, we have younger men, we have heterosexual and homosexual men, and they really are quite different. Do you think there's any one thing that stands out?
I think the media. I mean, you can't look at a magazine cover and where it used to always just be women on that. Now you have, besides Brad Pitt, you have tons of them, and they're usually shirtless, like Chris Hemsworth, all these things, and men
Both
want
the
to
Hemsworth
look
brothers
like that.
are fine with me.
See,
I totally agree.
Yeah.
And it's just, and the images though are becoming more and more, how do you say it? I mean, high def. I mean, you see every little thing, and I think because of that, it's two things. One, people want it. Secondly, the actors realize that you're going to see everything, so they really get pumped, so-called, for the
They're
roles.
very disciplined.
Oh my gosh, yeah. And we're getting better at figuring out how to make people look this way. So it's not always surgery, by the way.
well,
No.
movies like, what is it, Magic Mike, XL, I mean, there you go right there, why men, you know, their girlfriends, their wives, everyone's talking about it. They want to look like that.
Yeah.
So tell me about the man cave. What is it? I've been hearing that it's like this separate office waiting room for the fellas.
Well, I think the concept of the man cave is, I mean, what we also think about like in our homes, right? It's the place where men go and relax and do their thing. So it's taking that and bringing it into the medical world. It's the same idea. It's a place where men can come and feel comfortable in a place where they may not feel so comfortable. I think in reality, though, it may be a little overkill. I don't think most practices need something like that. I think most practices just need to be cautious of who they're marketing to and who they're dealing with. I think a lot of practices are used to women. It's different, you know? The feel is different. The way you talk to them is different. The way you hold their hand is different. So,
I also think, though, it comes to mind is a man doesn't necessarily want to walk into an office that's too frilly with doilies and this kind of thing. They still want to be comfortable, because some people are a little embarrassed at first as men that they're going to a plastic surgeon's office. So if that were available to most, yes, but as he said, it's not practical for every office to have a man cave.
yeah. And so, well, some men are actually very embarrassed. I mean, they won't come in unless
Right.
they feel comfortable.
Right.
They're
It's,
coming in with like the hood on and they have like their
yeah.
bodyguards.
Yeah.
But it's interesting because men getting work done used to be taboo in the past and now it's becoming more regular. Why do you think that is?
Well, I think it's the media. We talked about the media already. That's a huge part of it. I think it's just people are becoming more comfortable for a number of reasons. There's all these reality TV shows that are based on plastic surgery. The more you watch these shows, the more you realize what it actually is. And you're like, oh, okay, I see it, I get it, I understand what this is all about. I think men are becoming a little more competitive in this visual world we live
Absolutely.
in with one another. So it used to be, you know, you make a lot of money, you're successful, you have a nice car, you're gonna get a good-looking girlfriend, right? I don't know. Now that there's a guy who has everything you have, yet he's good-looking.
Yeah, it's like it's not enough to have arm candy. You need to be your candy too.
Yes.
Well, it's just fillers and neuromodulators now. They've been around a lot longer than 10 years ago. Now every office does it. Everyone knows about Bro-tox. So they're not necessarily so afraid. And with a man, if you get rid of a frown, they're hooked
They're
in that
refreshed.
regard.
Yeah.
So tell me, what are some of the most popular procedures being done in male aesthetics?
Why don't you
Well,
go first?
We did something called Bro-tox. And that was because men handled Bro-tox a little bit differently, meaning they don't want to be completely smooth, they don't want to be pretty, Our tagline was, you want to look rugged, you don't want to look haggard. And I think that's a big thing with men is they just want to look good, but not like you've been fiddled with too much. At least that's what I found in our practice.
I completely agree, surgically too. Overdoing men is a huge no-no. Less is more, especially when it comes to facial aesthetics. Now, when you're talking about the body, that's a little different. Men, there's this unattainable, ideal of a male's body that's all in the media these days. It's that super ripped, muscular dude, right? And there are very few of us can actually achieve that on our own. So with surgery, you can actually come close, but that's what most men are, at least, theoretically want from surgery. They want to look ripped, they want to look studly.
So you feel there's more of a concern with body versus face, or are they pretty on par with each other?
I don't know. In the real world, I go to the gym quite often, and there's plenty of people who work filled with people worrying about the six-pack, and then they don't have a face to go with it. I think that's starting to change now, because why do you work so hard on all this, or go see someone like Dr. Rogers to have a liposuction, and then have a face that,
Well, I can tell you though, surgically speaking, there are fewer facial surgeries done on men now than there were 10 years ago. But I think it's because we have other things. We have fillers. So you don't necessarily need to have a facelift or whatever it is. You can do little things. And really that's all what men really want, that little bit. The body.
Also men with pain too. Women can take a little more pain, right?
That is true. I
have to agree on
that.
Have to agree on that.
So yeah, that's part of it too. Men don't want to have pain if they can help it. Even with body sculpting though, I mean, I do a lot of body sculpting surgically, but we have machines now that can sculpt your body without surgery.
So tell me about cool sculpting.
Cool sculpting is, it's a device that's been out there for a few years now, but it's really gained popularity, partially because it works. Not only does it work, it's reasonably comfortable. A lot of these other devices that also work hurt, whereas cool sculpting does not.
Talking about that pain factor again.
And it's not surgery, and there's minimal recovery, and it's all the right things to say to men. That's what men want. They want to get rid of that. They just don't want surgery.
Well, and again, they can say they've never had surgery. Men don't like to admit that. And lasers and some of these things that we have now, that doesn't mean they had surgery.
Yeah, you're right.
It's part of that mentality of, I haven't had anything done. Different people in the media have made it okay to have lasers, just not to have surgery.
Yeah, no, that's true. That's considered maintenance versus an alteration.
And then you touched on this, but tell us a little bit more about the facial injectables that are available to men and what they're getting.
Well, they're all the same, clearly, as we use for women, but men's faces are shaped a bit differently. You look at more of a square face for a man that looks strong, athletic, testosterone. We're all driven to those looks.
Masculine.
That's right.
That's the key word. That's the key word.
Well, it is. There's. And women, though, when they start to become square, that means they're no longer fertile. They're not as interesting to a man that's hardwired to look for that. So women, they want this look, and a man, you want that look. It's just kind of that simple regards to that.
Interesting. And obviously there is a risk of feminization of the face with men. Talk to me about how you deal with staying away from that.
Well, in my aspect, it's not making the cheeks go out as far. Men are a little more straight up and down. They can have a little atrophy in the cheeks, and that looks male.
That's
it looks
kind of
great.
like the chisel look.
Right. But of course, when a woman has that, then again she starts looking more masculine. So, and they don't want to look masculine. But and men, it's a hyper. I mean, recently they just showed some pictures of a man being a little less testosterone driven, and a lot of women are starting to like that look again, or I should say now. But in the past, that's very much of a boy, and most women aren't interested in boys.
We want men. We do. So I have to ask about these dreaded moobs, or man boobs, for those of you who aren't familiar with the term. So
it's a real thing.
It is a real thing. So Dr. Rogers, tell me, what are we doing about them? And it is scientifically known as gynecomastia,
Gynecomastia.
not man boobs.
Well, it depends on the circles you know. There's actually two different things. Gynecomastia is when there's actual breast tissue in there. And you can also have just fat, which can look very similar but with no breast tissue. So the treatment of such is, there's some treatments that overlap, but they're actually quite different. So if it's breast tissue, and if it's not caused by a hormonal imbalance or something like that, you surgically have to remove it. You can't liposuction it out. If it's just fat, you can liposuction it, you can freeze it, you can do all kinds of things to try to get rid of that fat. Or if you just dye it, most of it will go away.
And those are two very different things.
Well,
They
it also
are.
does really look quite different. Gynecomastia, it looks more pointed where
Yes.
a moob or a man boob is something that I'm starting to get, is that the
Stop it.
pecs used to be here are now being a little less there.
Yeah.
You're
Well,
going to be sleeping in your man bra at night.
oh yeah. Oh, there you go.
Oh, there.
All right,
Our next
underwire?
thing.
Next product, give me 5%. No, but it is interesting, and I have to, of course, ask about hair restoration, because when that hairline starts going back, that's one of the telltale signs. So what are some options for treating that?
Hair restoration is, it's a huge market. So before we had grafting, people wore their toupee, right? And actually they can look pretty good. People still do it, and there's things you can like add hairs to your own hair.
Kind of like that,
But-
are they, aren't they?
Right. But nowadays, it's realistic looking. It's not like the old days where they take a big old plug and give you a doll head, which it happened. It all happened.
We've seen a lot of celebrities in between, that phase.
Yeah, that's not a good look. But nowadays, there's basically two techniques. There's the strip technique, where you take literally a strip of hair from the back, you cut a piece of scalp out, you close the area you took it from, you take that strip and you turn them into little tiny, like each follicle is a graft, and you build a hairline or thicken up hair wherever you want. The second technique is similar, and you're taking still hair from the back, and the reason we take hair back here is this hair typically never falls out. But the second technique is called FUE, so it's follicular unit extraction. You're taking one follicle at a time. So that's like a little tiny punch.
That's time.
It's more time consuming, but it's there's no scar, so you don't have to worry about that big scar. I don't know if anybody saw that. It was kind of a big thing a few years ago when Jeremy Piven was caught jumping into the ocean with a big old scar.
I feel like he was on vacation and
not nice, but it was a bad scar. So you don't have to worry about that with this type of technique. And otherwise, the rest of it is the same. You're still putting them one at a time.
And also with men, we typically bald a different way. Women are now using this as well by placing it. They usually lose their hair here. And also after surgery, some people lose hair around the
facelift. It pulls the
That
hair
would make
back.
sense.
So it works really well, these single follicles.
Yeah, and some women have a high hairline.
They
Big forehead.
do.
A 5 head.
Yeah. Yeah.
Nobody wants that. You need bangs.
Right. So there are ways you can use it for both men and women.
So now that we've kind of gone through the most popular procedures out there, let's talk about some of the unwanted side effects from some of these surgeries. Can you break down some examples of that?
Oh my gosh, there's all kinds. Depends on what kind of surgery you're talking about.
Well, I know a big one is butt implants.
Okay. Yes. Butt implants. A butt implant is essentially a big piece of silicone rubber, okay? And it's shaped in such a way that hopefully once it's put in there, it looks natural. The problem is about 50% of the time, it doesn't look so natural. And, I think a lot of people tolerate it because they're not looking at it every second of the day. It's behind them, right? But they don't look so good. There are alternatives. Of course, you can do fat grafting instead. So fat grafting is a whole new thing instead of implants. If you have fat, you can use that to do the whole Brazilian butt lift.
And then do you get to do the fun where you get to eat really bad for a little bit and get some fat going?
Yeah, yes, but then you got to maintain that, right? Because if you gain extra weight, do the fat grafting, and then lose the weight, then you're going to lose your butt. So I usually don't tell people to do that.
Yeah.
But
Speaking of butts.
The implants have pros and cons. In some cases, you have to resort to something like that if the patient really, really wants something because they have no fat.
Would it almost be a good idea to have them wear like the little, you can put the little fake pads in your jeans, test that out for a little bit, right?
Oh, you could do that, and those underwear exist. There's a company that does that.
Yeah.
I forget the name, but do you remember?
No, I did give that out as presents for Christmas to all my friends.
All right, next year I'm coming to your party. All right, now, I've seen news stories about plastic surgery cases such as the human Ken doll. And Dr. Rogers, I hear you've performed surgery on him.
Yeah, I did. So I was a little hesitant to work on him, just because he's not my typical patient. He's obviously extreme, and I'm not a huge fan of implants really, because they have the risk of certain complications. We talked about them not looking good, but they can get infected, they can get displaced, they can really not give you the look you're looking for, and you have to do revisions and all things like that. So bottom line was, after I saw him, I realized he's actually quite bright. He's not nuts. He does not have body dysmorphia. Now, body dysmorphia is when like a very tiny little thing or even a perceived thing ruins your life. That's not him. He's motivated by a totally different thing. For him, this is kind of his vocation. This is his mission in life. It's what makes him matter.
It's his passion.
It is, and he takes it very seriously. He understands the risks. He understands that these things, sometimes they go right, sometimes they don't. Sometimes you need a revision. He's been down the road. He's had I don't know how many hundreds of surgeries and implants prior to me ever seeing him.
You.
Right.
Well, I hear we have him in studio, so please welcome Justin Jedlica, also known as the Human Ken doll, to join us today to tell us himself. Hi.
Hey. Nice to see you, Stuart.
Good to see
Nice
you.
to see you. I'm
Yeah.
loving this blazer.
Thank you. Well, I try to dress appropriately for the function.
Absolutely. So we would love if you could tell us your personal story, your transformation, and commitment to attaining your perfect look and physique.
Sure. I mean, when I was a younger kid, I had a lot of angst with my nose, and it was something I didn't like. And so when I was 18 years old, I went and had my first nose job. And through that process, I really realized all of the different possibilities that I could have with modification in my body. And I always was a very artistic person. I love sculpting and painting. And I began to sort of compute this as a medium for me to be able to create with and to be able to sculpt my body. And over the years, I found several different doctors, and I've thought up a lot of different procedures and worked on implant design, to where I really use plastic surgery as a way to set myself apart as an individual, to customize myself. And that is what continues to bring me back to the drawing board here and on modifying my body. I guess it comes more from a standpoint of body modification than reconstructive purposes, where I'm looking to sort of just be like the rest of the masses or feel like I just fit. I'm looking to make myself extremely distinctive.
And what led you to your most recent surgery that a lot of people saw on Ease Botched?
So it was a combo surgery. I wanted to build out the wings of my back. And I had already had pec implants and deltoid implants, bicep, tricep. So in an attempt to sort of broaden the frontal portion as well as the back of my back, I decided to do latissimus implants, submuscular, and then teres implants. And that led me to Dr. Rogers. I had several referrals to him from friends. But additionally, when I was researching doctors, he had a lot of experience working with the latissimus muscle and using that to reconstruct busts that had deformities that needed to be fixed. And that was really sort of the clincher for me, because I knew that he'd be knowledgeable with that space. And after having met him, I mean, his bedside manner, his demeanor was so non-judgmental, and
could he be more charming?
no, or good-looking, right? It doesn't hurt. Nice on the eyes.
Turning red. Okay.
But no, but we had really good banter back and forth, and he was very open to listen to my wants and interests, and do it in a safe way. I think we met probably 8 months to a year going back and forth over implant design and rethinking, was it one implant, on each side of the lat, or we ended up doing 4. And then eventually I tacked on the forehead vein ablation that we had worked out, because I wanted to get rid of these, what I call Julia Roberts veins.
Oh, I hear you. I have them. Yeah.
When you smile,
if I'm
you
mad,
red
you
carpet.
see them. They come out.
It's
you know.
Nice. I know. I felt like they were kind of witchish. I mean, it was sort of an afterthought for me. I mean, really, I wanted to do the back implant surgery. And I was looking to sclerose those veins anyway, and the more I read up on that, it didn't seem like the safest fit because of the way that the blood seems to pump through the veins there into the head. And I had doctors that said they would do it.
It's very high risk.
Well, they didn't tell me that, and actually it was much more affordable than actually ablating it. But in talking to Dr. Rogers and in knowing that I could do it in tandem with this procedure, it was a knockout of the park to just combine it all at once.
So were you both happy with the results?
I was. I am. I'm thrilled. I mean, it's definitely sort of become my claim to fame. You know, my body implants are sort of what I'm known for, and it adds sort of another notch on my belt as sort of doing something different and being an innovator in that field. But I couldn't have done it without Dr. Rogers and his openness and availability to listen to me and for us to work together.
Communication is key.
Oh, it's huge. But I do have to admit, though, part of my wanting to do this surgery is selfish. It was something that's not been done. It's very interesting to me. I love a project. I love a puzzle. I mean, he's a puzzle.
With a lot of pieces.
So it was exciting for me to try to develop something different. I also saw some application for it that wasn't necessarily just for cosmetic. For patients who've lost latissimus because we've had to use it for reconstruction, I mean, it's not a muscle you technically need to survive, but it can make you look a little asymmetric. So, well, if we can replace that in certain people, especially if they feel, uneven, unattractive, whatever it is, then great. Now we have a new implant at our disposal. We use them for breasts, why can't we use them for other things? So that was part of my motivation for doing it as well. Now, I do have a question for you though. How do you deal with the potential risk every time you have surgery? Because there is some risk. I mean, these are relatively safe surgeries, but still surgery.
Well, I mean, we're doing them with professionals. I mean, obviously I chose you. I mean, I look for the best of the best. I mean, I always listen to my doctor's instructions. You have to take it seriously. It is definitely a surgery. But I think the power of positive thinking during the healing process is something that's definitely gotten me through a lot of these procedures quickly. I mean, I usually stage a recovery house and I almost build an event and a party around the recovery where I look forward to it.
An actual party.
Well,
Dr. Rogers knows I come in with my entourage of friends.
You.
And we look forward to the time together, and I don't really fixate so much in those first 2 weeks where I think a lot of people are angry at themselves, and I know my first nose job was really tough to get through, not knowing what to expect. And having gone through that, I have my regiment down of everything I need. I have it set up, and then I can sort of relax and sit back and just have my family and friends be around me to support me.
He's actually a very good healer too, which may just be genetic. So I mean, so he's lucky in that respect. He had very few complications, and it's just his scars are good, and he doesn't form like the capsular contractures at least that I've seen, and he's had lots of implants and a lot of opportunity to do that. So I think he just may, just by physiologic genetic chance, be a very good candidate.
Well, I mean, we did, and as far as the risks go, I mean, I feel like they're still fairly nominal, but we know what they are going in. It's something that we discussed in our surgery, and I discussed with my previous doctors, that, having this be a first would probably require a revision or two, and so, you go into it knowing that. I mean, no one's having an unrealistic expectation, I guess I should say here. So I'm okay with that.
It's transparent.
Exactly, and if the doctor's okay with that, to be able to forge forward and do something that's new, then I mean, I'm a happy camper, definitely.
So Justin, we were talking earlier about you as an artist, your artistry, and I understand that you actually designed an implant for someone else?
Sure. I mean, in my plastic surgery consultant services, part of what I offer is templating services for individuals. And in this case, Dr. DeBro from Botched called me up and brought me on as a consultant to help him out with a gentleman named Albert who suffered from Poland's disease. And with that disorder, he was missing his left pectoral muscle. And so we just had the clavicular head attached at the top, and he happened to be a bodybuilder. So it was a really interesting case because the rest of his body was so over-exacerbated, overbuilt, and yet he had this deficiency in his chest. So it was a real challenge, and I met up with him and Dr. Bro, and we worked through the implant together. I templated it and worked with the implant company to be able to get as close to a match as I could for him. And at the end, he was thrilled with it, and it was great because it really fit his physique. He even wanted to go a little larger because he was planning on building his body bigger, and we tried to accommodate for that as well.
But it is fascinating to hear between your work together and what you're doing for others, the time and the artistry, and it's kind of like building your house, people with their blueprints.
I think, unfortunately, a lot of people see people like Justin as extreme. And he gets a lot of criticism for that. And I think the doctors who help him get this way also get criticism. But you have to remember, I mean, everything we do at one point was considered extreme. Look at Botox. I mean, Botox is botulinum toxin. I mean, botulism, right? I mean, it kills you, right?
It's scary.
Well, we're using it in a way that helps you. And now it's everywhere. So you need these people to innovate. And innovation really means pushing the envelope. You just have to do it in an intelligent way that doesn't take too many risks or, with good judgment. And we can change the face of medicine, of the world, and we can advance our species even. I mean, come on, this is how we do it.
Well, it's exciting. Who knows what we'll be talking about 5 to 10 years from now.
Exactly. It'll be very interesting, actually.
Well, this has been such a fascinating discussion to hear about the latest trends in male aesthetics. Thank you all so much for joining us here.
Oh, thank you. It's my pleasure.
Thanks for
And
having
thank
us.
you to you at home. I'm Stuart Brazell. Stay tuned and stay beautiful.